Hello, my name is Dominique Damien. I'm a safety director with Washington Farm Bureau. Today, we will be discussing the risks of outdoor heat exposure, the symptoms of heat-related illness, and the state requirements. Employees are required to be trained on these topics annually prior to working in high temperatures or before May 1st. The goal of this presentation is to prevent heat-related illnesses and possible related injuries. Today, we will cover the trigger temperatures at which outdoor heat becomes hazardous, factors that contribute to chances of contracting a heat-related illness, the signs and symptoms of the different heat-related illnesses and how to respond to them, and then actions you can take to prevent heat-related illnesses. This training is important because extreme heat is yet another variable that threatens agriculture workers' efforts to support themselves and their families. Did you know that heat-related illness can be more than just uncomfortable? Extra care is needed when working outdoors because under certain conditions, heat-related illness may become very serious and even cause death. Heat affects you physically and mentally and can lead to other workplace accidents as well, like car accidents and trips and falls. In addition to being a serious health risk, heat-related illness may mean time away from work, which means lost wages, medical bills, and of course the resulting stress on worker families. The good news is that heat-related illnesses are completely preventable. Washington State has developed a table of hazardous trigger temperatures based on the type of clothing employees wear. The first trigger temperature starts at only 52 degrees. This may be hazardous for anyone wearing non-breathable clothing, including vapor barrier clothing or PPE, personal protective equipment, such as chemical-resistant suits used for certain pesticide applications. The second trigger temperature starts at 77 degrees for anyone wearing double-layer woven clothes like coveralls, jackets, sweatshirts, regular rain gear, and when temperatures hit 89 degrees, everyone else working outdoors for more than 15 minutes may be at risk. Heat-related illness, sometimes called heat stress, happens when your body can't cool down enough to maintain its normal temperature. The environment doesn't need to be extremely hot, as we saw in the previous slide. We can get a heat-related illness during heavy physical work in just warm conditions. There are several types of heat-related illnesses. This table starts with the less serious illnesses and progresses to the most serious. Heat rash being the least serious illness, then heat cramps, heat syncope, heat rhabdomyolysis, heat exhaustion, and the most serious being heat stroke. The following slides are about the signs and symptoms of the different illnesses and the first aid response measures one should take. Heat rash is a skin irritation caused by excessive sweating during hot, humid weather. It presents as red clusters of pimples or small blisters, usually under the neck, on the upper chest, in the groin area, under the breasts, or in elbow creases. First aid response should be to move to a cooler, less humid work environment and to keep the rash dry. Do not use ointments or creams on the rash. Heat cramps usually affect workers who sweat a lot during strenuous activity. This sweating depletes the body of salt and moisture levels, and low salt levels in muscles cause painful cramps. It will present in large muscle groups as a pain or spasm in the abdomen, arms, or legs. Heat cramps may also be a symptom of the more serious illness, heat exhaustion. First aid response should be to drink water and have a snack or sports drink every 15 to 20 minutes. You want to avoid salt tablets, but get medical attention if the worker has a heart problem, is on a low sodium diet, or if the cramps do not subside within 1 hour. Heat syncope is a fainting episode or dizziness that usually occurs with prolonged standing or sudden rising from a sitting position. Like the other first aid responses, you will want to move to a cool place and sit or lie down and slowly drink water, clear juice, or a sports drink. Rhabdomyolysis results in rapid breakdown, rupture, and death of muscle. When muscle tissue dies, electrolytes and large proteins are released into the bloodstream and can cause irregular heart rhythms, seizures, and can damage the kidneys. Symptoms of rhabdomyolysis include muscle cramps or pain, abnormally dark urine, which may be tea or cola colored, weakness, and exercise intolerance. Some people suffering from rhabdomyolysis may not show any symptoms at all. Workers with symptoms should immediately stop activity, increase water intake, seek immediate care at the nearest medical facility, and ask to be checked for rhabdomyolysis, which may require a blood sample. Because some people may never show symptoms, it is always important to stay hydrated. Heat exhaustion is the body's response to an excessive loss of its water and salt, usually through excessive sweating. Workers most prone to heat exhaustion are those who are elderly, have high blood pressure, and those working in hot environments. Symptoms of heat exhaustion include dizziness, headaches, heavy sweating, fast heartbeat, nausea and vomiting, weakness, muscle cramps, irritability, thirst, and an elevated body temperature. It is important to note that pesticide poisoning and heat exhaustion have similar symptoms. However, excessive heat will cause large pupils and dry mouth, but pesticide poisoning from organophosphates or carbamates will cause small pupils and salivation. Treat workers suffering from heat exhaustion with the following. Remove the worker to a cooler area and give him or her liquids to drink. Remove unnecessary clothing, including socks and shoes. Cool the worker with cold compresses or have the worker wash his or her head, face, and neck with cold water. Encourage frequent sips of cool water. Take the worker to a clinic or emergency room for medical evaluation and treatment. If medical care is unavailable, call 911. Have someone stay with the worker until help arrives. It is important to treat heat exhaustion quickly before it turns into heat stroke. You can prevent a medical emergency by acting early. Heat exhaustion or heat stroke may develop over a few days. If you've had symptoms yesterday, you are more susceptible today. The most serious heat-related illness happens when your body becomes unable to control its temperature. Heat stroke occurs when the body's temperature rises rapidly, the sweating mechanisms fail, and the body cannot cool down. The body's temperature can rise to 106 degrees Fahrenheit or greater within 10 to 15 minutes. It can cause permanent disability or death if emergency treatment is not given. Heat stroke symptoms include red hot skin, sweating may stop, confusion or not making any sense, collapse into unconsciousness, seizures or convulsions, very high body temperature, and even death. If heat stroke is suspected, immediately call 911 for emergency medical care. Stay with the worker until emergency medical services arrive. While waiting, move the worker to a shaded, cool area and remove outer clothing. Cool the worker quickly with cold water or an ice bath if possible. You want to place the cold, wet cloths or ice on his or her head, neck, armpits, or groin, or soak clothing in cool water. And then circulate the air around the worker to speed cooling. It may be difficult to tell if the worker is experiencing heat exhaustion or heat stroke. If the worker cannot answer their name, the day, or location, assume it is heat stroke and call 911. Additionally, this is a nice graphic to quickly make the determination. Remember that if heat exhaustion is not quickly treated, it may turn into heat stroke. There are several types of factors that can increase your risk of developing a heat-related illness. Environmental factors include high temperatures, obviously, but also high humidity, lack of any breeze, working in direct sunlight, or other heat sources around you, like heavy equipment in the field. Some occupational factors that may increase your risk of contracting a heat-related illness include the use and type of personal protective equipment and clothing. Some types of personal protective equipment and clothing make it more difficult for your body to cool down. To help maintain body temperature, the body sweats, which evaporates from your skin and cools you down. Heavy, dark, tight-fitting, or non-breathable clothing make it difficult for sweat to dry and cooler air to reach your skin. Additionally, your body produces more heat the harder physical effort you do. Some examples of moderate activity are things like scrubbing in the standing position, walking with a moderate lifting or pushing, or walking on level ground at about 4 miles per hour while carrying a 6 to 7 pound weight load. Examples of heavy activity include a carpenter sawing by hand, going up and down ladders, chopping weeds, heavy assembly work on a non-continuous basis, intermittent heavy lifting with pushing or pulling like pick and shovel work. And some examples of very heavy activity include shoveling wet sand, bucking hay bales, or hand chopping hop vines. Some personal risk factors affect how your body senses and responds to changes in temperature. You are responsible for monitoring these personal risk factors because no one else will be able to. Personal risk factors include dehydration, poor diet or poor fitness, certain medications, which will make you more sensitive to the effects of heat. They may affect how much you sweat or how much you urinate or increase muscle activity. All of these can increase internal body temperature, so consult with your doctor or your pharmacist about your specific medications. Some examples are antidepressants, diuretics, allergy, blood pressure, and thyroid medicines. Alcohol and drugs affect your body. Working under the influence or with a hangover may increase your chance of a heat-related illness. And acclimation, not being used to the heat or the work conditions, can also contribute to your risk. Continuing, additional personal risk factors include advanced age, or as I like to say, advanced levels. Those who are 60 years or older are more susceptible to heat-related illness. Medical conditions such as diabetes, heart condition, kidney disease, and others. Lack of sleep, pregnancy, or previous heat-related illness can contribute to your risk. So how do we prevent heat-related illnesses? Two important prevention methods are acclimation and water. If you haven't worked in hot conditions for a week or more because you're new to the job, new to the environment, or have been away for a while, you need to take time to adjust to the conditions. You can lose your acclimation if you're away from the hot conditions for a week or more. It is important to recognize that we are all different and each person's tolerance to heat is unique. That is why it's essential to monitor your own personal risk factors. A sudden heat wave is something most of us will not be acclimated for. You may need to take more breaks and pace the work you're doing for the first week of working in the hot temperatures. Water is the best way to replace fluids. Non-sugary, non-caffeinated drinks may be okay too. It is better to drink small amounts often, like a cup every 15 minutes is better than drinking a quart or a liter all at once. You don't want to wait to be thirsty. But drinking too much water all at once can also be harmful. No more than 48 cups in a 24-hour period is recommended. Ask your employer where your water replenishment is. Sodas and other drinks containing caffeine and sugar will not prevent dehydration. Generally, snacks and meals will replace the salt minerals lost in sweat, so there is no need to take salt tablets. These can irritate the stomach and cause nausea and other discomfort. You want to avoid waiting to be thirsty to drink water, avoid sodas and sugary drinks, lots of caffeine such as energy drinks, and working with a hangover. You may need to take breaks more often. While on your break, remove any unnecessary clothing or personal protective equipment. It allows sweat to evaporate from your body and cool off. You want to rest in the shade or in a cool area and drink water. Remember, thirst is a lagging indicator of dehydration, so it is best not to even get to that point. Note that the outdoor heat exposure rule does not specifically require breaks, except when a worker shows signs of heat-related illness. This is from the NIOSH criteria for a recommended standard, Occupational Exposure to Heat and Hot Environments 2016. In general, when you are hydrated, urine should be clear or light yellow. A dark color is a sign of dehydration. Diet, like eating beets, some medication, and health problems can also change the color of your urine. However, this may help you monitor your body's hydration level. If you or your coworker begin showing signs of a heat-related illness, follow these steps. Tell the person in charge or a coworker that you need a break. Remove unnecessary clothing and personal protective equipment. Move to a cool, shady area and drink cool water or an approved beverage. Place ice packs or wet towels over the body. Don't leave without a buddy. Note that this chart emphasizes how it is important to monitor your own risk of heat-related illness as well as checking on those around you. Now let's take a quick quiz to test your knowledge. True or false? Cola drinks are the best way to hydrate when you are working outside. False, of course not. Water is the best way to stay hydrated while working outside. Light-colored clothing is better than dark-colored clothing while working in the sun. True, dark-colored clothing will absorb heat and make the individual hotter. Your medicine may make you more vulnerable to heat-related illness. True, and it is important to talk to your doctor if you have any concerns. It is important to drink water all at once. No, false. It is important to drink smaller, more frequent amounts of water throughout the entire day, including before and after work. Great, now let's wrap up. To prevent heat-related illnesses, acclimate or take the time to get used to the working conditions. Alternate between heavy and light work whenever possible. Wear light-colored and breathable clothing. Also, wearing sunscreen and a hat can protect your skin from the harmful sun rays. Don't wait to feel thirsty. Drink water often throughout the day. Take breaks in a cool area and rest. Remove personal protective equipment during breaks. Monitor your own personal risk factors that can increase your chances of a heat-related illness. And of course, watch each other for signs and symptoms of a heat-related illness. If you have any questions, please talk to your employer. If you need additional help, feel free to contact us at the contact information below. Thank you for listening to this presentation and for being safe. Good health to you all.